9:20 right now. For years, we've heard black women are at a disproportionately higher risk of dying from breast cancer, and new research suggests our screenings should begin long before we've been told before. And joining me now to talk more about this mammogram mentality shift is Dr. Wendy Goodall McDonald, OBGYN at Women's Health Consulting in Northwestern Prentice Women's Hospital. Good morning to you.
Good morning.
Thank you so much for making time for what I think is a really important discussion. We understand there's no one-size-fits-all approach to really anything, but this information published in the new JAMA Network Open Journal says 42 is the new age that we should start getting screened instead of 50. What are your thoughts?
So here's what's interesting about that. The American College of Obstetrics and Gynecology, ACOG, has said for years that we can actually start offering mammograms at age 40. Now, the United States Preventative Task Force has said offer a mammogram starting at age 50. And the American Cancer Society splits the difference and says offer them at 45. I offer my black patients, actually I offer all my patients mammograms starting at 40 because really what it comes down to is early detection. So I'm all for this 42 recommendation, but also when it comes to African American women, although we are 4% less likely to develop breast cancer, we are actually 40% more likely to die from breast cancer. Multiple factors contribute to that, but early detection is key.
Yeah, and I feel like maybe are the different ages given, does that play into whether insurance is going to cover this?
There are multiple factors. Some of it does come down to cost. Some of it actually is the risk of finding something that's actually not cancerous and increasing worry, anxiety, and more testing. So there are, the part of the later guideline comes down to if we find something, how likely is it cancer? But you have to split that with if you find something and so basically as a patient, right? If I have a finding, I have to understand that it may not be cancer. I may be okay, but I need to follow it up because if it is, and if it's an early cancer, my survival rate is like over 95% for something detected that early. So it's cost, but it's also risk of overdiagnosing. But ultimately, if you're trying to catch something early, I think we can take that risk.
Yeah, and that was one of the questions I was going to ask you about the guidance. Would it lead to unnecessary treatment or even stress for women?
Stress for sure, not necessarily treatment, because once you get like an early screening mammogram, and if you go for a diagnostic mammogram or a biopsy, then you're not going to be subject to cancer treatment. They'll know if it's cancer or not, but you can certainly, kind of have to go through those steps, especially if something like a lump is detected and needs to be followed up. So yes, anxiety, stress can be a factor, and actually one of the reasons why African American women are more likely to die from breast cancer has to do with follow-up, has to do with the clinicians following up with the patients, and has to do with the patients coming back. And fear and anxiety can play into that as well. So we have to kind of understand that every abnormal screening isn't cancer, but we should follow it up and see it through in order to make sure that it's not cancer.
Let's talk about this. Is this more about systemic issues or biology?
Both, because not only are black women, less likely to sometimes get those calls for follow-up and to be, chased down or pursued to have that further imaging, our cancers as African American women, again, though less likely, can be more aggressive. The actual tissue itself, the actual ability for it to spread and to be aggressive in our bodies is actually higher. Now, why is that? Is there stress? Are there epigenetic changes that come into play? Possibly. But there is a genetic reason why we are more likely to die, but also there are systemic factors in place as well. So ultimately, if we can catch something early, then we can deal with those things a little bit better than if we're catching it later. Even by the time you can feel a lump, it has already progressed to a point where potentially where it can be harmful. So it's important for us to find things even before you can feel them, and that's where mammogram comes into play.
And outside of a cure, what more do you think needs to be done? I mean, I appreciate the fact that we're having more of these conversations, but what else needs to be done or even research to save more lives?
I think that we need to do, a lot more research when it comes to cancer treatment and the differences in the types of cancers when it comes to different people and populations. Honestly, African American people need to be willing, it's going to sound crazy, but be willing to participate in some of these studies as well. Because there is sometimes a cultural concern about kind of being the guinea pig or being tested. But there are sometimes these nuanced differences between our cancers and cancers from other populations. And so to be a part of these studies, if we do find ourselves, affected by cancer or precancerous changes, we can actually help the next person and the next generation with better treatment.
Yeah, I think that's a wonderful way to end this part of our conversation, is looking forward to how we can help generations to come. As always, ladies, we want to discuss your options with your physician who knows your unique story, but we want to thank Dr. McDonald for being here and sharing your insight with us this morning. We appreciate it as always.
Thank you for having me. Thank you so much.
Take care.